Welcome to Adapt NCLEX. They say the NCLEX is hard, but at Adapt NCLEX, we're trying to make content simple. I have therefore arranged 85 questions like before, but this one is harder. It's going to challenge you. We're going to go through all the things they test you from cardiology to peds, mental health, maternity, prioritization, delegation. I want you to take a ride with me. By the end of this session, you are going to be one step closer to passing your NCLEX. These are hard questions. If you get in more than 65, then you're closer to passing your exams. Take a pen and paper, take a ride with me, and as usual, stop the video, answer the questions on your own, and then keep your score. Let's get to it. Adapt NCLEX. We are dealing with safety and infectious control. These are high-yield topics you have to master. If you ask anybody who's taking the test, this is there, whether you like it or not. So let's blow this up. Master this concept as much as possible. What do we have? Which action should the nurse take first? Read the question from the back. A nurse is preparing to enter the room of a client with what? Clostridium difficile. Which action you take first? Don gloves, don a gown, perform an hygiene with alcohol-based sanitizer, wash hands with soap and water. What do you think? Stop the video, answer it on your own. But if I'm taking the test, this is the way I will approach it. I ask myself, what is the question asking me? He said, first, of what? Somebody would say, Dave, I'm preparing to enter the room. Basic, standard, precaution, everybody. Before you go and see anybody, hand hygiene before and after. Don't get tripped by the fact that it's C. diff, therefore you say, oh, I got to wear gloves. How about a gown? You got to wear both to go in. Therefore, if I separate them, that means both of them are wrong. You got to wear both to go in. The best thing to do whenever you examine the patient, wash your hands in soap and water. Why not alcohol-based hand sanitizer? Because C. diff, you need to wash your hands. That's all. Concept. Every question, I will show you the concept, and I want you to write it down. Take a pen and paper and write it down. When you see C. diff, wash your hands, soap and water. No hand sanitizers. And if you go in, gown and gloves. Number 2. Which action by the UAP require immediate intervention by the nurse? It's a safety question. A nurse observe a UAP assisting the client who is at risk for what? Fall to the bathroom. The client is wearing non-skid footwear. The bed is applied. The bed alarm is turned off. The UAP remain with the client. Which one is a safety violation? That's all. Stop the video, pick your answer. But that's the concept. Safety violation. Non-skid footwear, you're not going to fall. Therefore, that's good. Bed is applied. Safety is applied. Bed alarm is turned off. Violation of safety. That's your right answer. UAP remain with the client. Safety is assured. That's all. Don't overguess. Don't challenge yourself. You know the content. Pick it and walk away. Which finding require nursing intervention? Selected apply. I got to intervene. Something is wrong. A nurse is caring for a client in what? Bilateral soft wrist restraint. Which one I need to intervene? Capillary refill of 4 seconds. Is that a bad thing? Skin redness under the restraint. Do you think is bad? Restraint secure to the what? Bed rails. What do you think? Range of motion was performed every 2 hours. And the client is calm and asleep. Stop the video, pick your answer. It's a selected apply. Stop the question. Don't over-select. Pick those you're confident. You pick your answer? I know you pick it. Let me give you the answer. Number 1, we got to intervene. Capillary refill greater than 2 seconds, it means perfusion problem. 4 seconds is bad. It's taking a long time to blood flow. We're choking the hand. The skin redness under the restraint, same thing. We're choking the wrist. Restraint secure to the bed frame or to the bed rails. That's the problem. It should never be attached to the bed rails because it moves up and down. range of motion performed every 2 hours. It's a good thing we're doing it. And asleep, what? The client is calm and asleep. That's a good thing. You don't have to intervene. ABC are your right answer. And this is reviewing the medical history of 4 clients, 4 of them. Which client is at greatest risk for developing an infection? That's the buzzword. Who is more likely to have infection? Somebody with osteoarthritis, hypertension, diabetes, and reflux. This is content mastering that NCLEX will ask you. You know it. Based on these 4 conditions, well, you know them. Who is more likely to have infection? You pick your answer, you stop the video, and they answer the question and proceed. Osteoarthritis is not infectious. They don't have infectious etiology. Diabetes mellitus, number 1 cause of infection. Hypertension, no. Reflux, no. A patient with diabetes, they look like they're immunocompromised. They have neuropathy. They're going to cause so much problem. They are the one who is more likely to get infection. Wound healing problem, everything is impaired. Number 5, which action should the nurse take first? What do you want to do? Like I said, infectious control. You can see some form of prioritization, but it's still infectious control. And nurse is preparing to administer intramuscular what? Injection, medication, IM medication, safety, application. What do you want to do? Don clean gloves, clean the injection site, verify the medication prescription, identify the client using to identifier. If you want to give a patient IM medication, which one you should do first? It's not asking for any other thing. What would you do? It's a safety question. You pick an answer. The first thing is to know to give the medication to the wrong patient. Therefore, verify identity. Of course, we're going to verify the medication. We're going to verify the injection site. We're going to don some clean gloves. But anyway, the first thing we do, I need to know if you are the one who is supposed to receive the medication through identity. Which nurse in action the nurse should recognize is the most effective in preventing catheter-associated urinary tract infection. You've seen it before. You've done it. You learn it in nursing school. If you're working, you're still doing it. Use your answer choice to answer this. What is the best form of preventing this infection? After you have attended staff education program, you empty the drainage bag every shift, you maintaining a closed urinary system, you clamping the catheter intermittently, you irrigating the catheter routinely. Which one tell you that I'm going to prevent infection, urinary tract infection? I can tell you, keep the system the way it is. It's a closed system. Every time you break the system, you break sterility, and there's a problem. Emptying the bag every shift, that's too long. 8-hour shift? No. Clamping, you're not supposed to. You have what? Stagnant of urine, bacterial overgrowth. You don't need to irrigate it. That's the problem. NS is notified that a client fell while ambulating to the bathroom and report no injury. Patient fell, no injury. Which action should the nurse take first? If you receive this information and then you're taking care of this patient, what would you do? Document the event in the medical record only, notify the provider at the end of the shift, complete an incident report, discontinue for precaution. If you've done most of these questions, all my 85 questions, you can see this is what? A safety question. Same thing when you do Q-Bank, anything, every time you're doing question, we will be able to recognize the question. It's a safety question. Therefore, pick a safety answer. Which one is a safety answer? Patient fell, report no injury. You're going to document incident report. Is that more important? Do you discontinue for precaution? You complete incident report. You notify the doctor at the end of the shift. What would you do? You go assess the patient and make sure everything is okay. Then you file incident report, because this is very important, and you let the doctor know. If you want, you let the doctor know at the end of the shift, the complete incident report. Which item should the nurse remove last? A, removal of PPE. You got to know it. A nurse is removing personal protective equipment after caring for a client on isolation precaution. I did not tell you whether it's the contact, droplet, airborne. It does not matter. Patient is in isolation. Which one do you remove? Those are trapped. It does not matter. The question says removal of PPE. What order do you remove PPE? You remove gloves first. You remove gown, goggles, or masks. You pick your answer. Stop the video. Let me know which one you remove first. This is common 3B for you, but it can be tricky. What do you think? The best way to remember this is to start alphabetically. If you don't want to use that, just use, because there's 3 G's in there. Yeah, alphabetical, that means you move to the second one. L-O, therefore, then if they are the same, you move to the next one. But it doesn't matter. The most important is the one that is contaminated. Which is more contaminated? It's usually the gloves. After you remove the gloves, then you remove the goggle, then gown, then your mask. The mask is the last one. But if you want to use alphabetical, all the G's go first. Then you move to the next one. L, right, is the problem. It's the lowest, so that one go. The O and O are the same. Therefore, where do you go? Goggles go second, then gown third, and mask fourth. That's what we remove. Which clients require the nurse to initiate contact precaution? A bunch of organisms. Which one you need to initiate contact precaution? There is a bunch of mnemonic. Whichever work for you, pick it and use it to answer this question. Contact precaution. A client with productive cough with cystic fibrosis. A client with fever and vesicular rash. A client with positive MRSA and culture. A client with nausea, vomiting, and positive latent tuberculin test. Which one need contact precaution? Pause the video, pick an answer, let me know. But I can tell you, use your buzzword, and that is what? Contact precaution, Mrs. Wee Hips, whatever you have. But this question, go through each of them, recognize what it is. Cystic fibrosis is a standard precaution, whether you're coughing or not. Vesicular rash, this is what? Varicella, you have airborne contact. Contact is not enough. MRSA is contact. And if you're vomiting, you have latent TB, you still standard precaution. Don't pick it. Which action best prevent infection? Which one? And this is preparing an IV piggyback medication for a client. Safety, infectious control. That's what we're talking about. Which one is going to prevent infection? Use sterile gloves during administration. Is that what you do? Labeling the piggyback with the client information. Do you label it on top of it? The questions say infection. Hanging the piggyback above the primary IV site. Cleaning the hub of the piggyback pot with disinfectant for 10 to 15 seconds. You've watched me multiple times. I do questions and I say, go for the buzzword. The buzzword in the question say what? Prevent infection. Therefore, we can answer choice where there is prevention of infection. They're saying something actively to prevent infection. Watch the video, put down your answer. But I can tell you the right answer is what? D. Why? There's cleaning of the hub of the piggyback, and you're disinfecting for 10 to 15 seconds before you do what you do. Hanging a bag does not say anything about doing infection. Labeling something, it has nothing to do with infection. Of course, wearing sterile gloves, but you don't wear sterile gloves. You wear clean gloves in medication administration. So that's no. Which action required the nurse to intervene? Bad problem. Which one? And nurse observe a graduate nurse provide care for a client diagnosed with what? MRSA and influenza. 2 problems. What do you think? Which one need intervention? That means you have to take care of both. There's 2 precautions you got to fight in your head. I'm leading you. I'm giving you the concept. as we go along, but pick your answer by pausing the video. Wear a disposable gown. Do you wear disposable gown for any of them? Display a precaution sign on the door. Should you do that? Disinfect the bedside table as needed, and then apply a sterile surgical mask. Which answer choice you pick? I can tell you, MRSA is what? Contact, right? We have a contact problem here. Influenza, we have droplets. Therefore, anything that does not satisfy any of them, that's your right answer. Where disposable gown is MRSA, contact. Display a precaution sign on the door for both. Disinfect the surface table, bedside table. Yeah, it's for MRSA, even influenza too. And then apply sterile surgical mask. Well, you need a mask for the influenza, but not sterile one. It's just a clean mask, just a surgical mask, but not the sterile one. Therefore, the word sterile change the answers. Number 12, how is the score so far? I just want to check on you. If you're tired, stop the video, go get something to drink and come back. And let's beat this NCLEX, overcome it with this high yield 85 question. As we go, the question get harder and harder. Don't get frustrated. I'm trying to twist you. I'm trying to make you confident so that when you take the NCLEX, you say, oh, you're doing practice run with adapting class 85. And nurse is caring for a client who need MRI. Safety question. Which action the nurse should take first? What do you think? Call the radiology department to schedule. You patient need the MRI. Do you call right away and schedule? Verify the physician, or do you go and check the MRI to make sure that there's something there? Patient need the MRI and verify is the name of the patient there. Complete the questionnaire for MRI. As soon as you say, oh, patient need the MRI, you start doing questionnaire. Do you check if the client agree? You go to the patient and say, hey, do you want to get an MRI? Which one is the most important and the first thing? Safety question. Which answer choice is safety? Of course, verify. You got to verify a legal order from the provider before you can institute it. That's very, very important. And that's the first thing. It's easy to pick C. I understand. It's a wrong answer. If you've not verified the order and you don't know whether that patient that you're going to take to MRI is the same patient who need the MRI, that's a problem, right? Of course, you're going to ask the patient. I mean, the doctor order MRI, you're going to interview them. You're going to call radiology to book it. But A, verify is the first thing. Always the first step, legally and clinically, is to verify a physician order to make sure it's safe for that patient. Which precaution the nurse should take, right? The floating nurse is giving a break to the primary nurse. The floater came giving a break. A client with MRSA need wound care. This patient had wound infection from MRSA and we need wound care. What should the floating nurse do? Don gown and sterile gloves, don gown and non-sterile gloves, don gown, goggles, face shield, and non-sterile gloves, don gown, goggles, and sterile gloves. What do you think? Wound care. And what do you think? You know, MRSA is contact, so you need gown and gloves. You're going to do wound care. There may be some splash. So you have to put a face mask on, you put a goggle, right? So that's why it's additional to that. So gown, you just gloves does not need to be sterile. So that's gone. You can wear gown, non-sterile gloves, but it's not enough. We got to change the wound. Don't gown, goggles, face shield, and non-sterile gloves. That's the best one. Don't gown, goggles, and sterile. We shouldn't do sterile. It's non-sterile gloves, face shield, goggles, and gown. What's the next best action? You got to do something best. All of them may be right, but not the best. When you see the question, interpret it that way so that you don't overselect. All of them are okay, but there's one best one. The next attempt to infuse what? Potassium IV to a client with hypokalemia. The pump indicate maintenance is required. What would you do? Give the medication using IV push. Give the medication using a pressure bag. Tag the pump and find another one. Use the pump with extreme caution. What would you do? What would you do? Safety. A more functional equipment should never be used for a patient. That's all. Potassium cannot be given by IV push. Wrong answer. If you use pressure bag for potassium, you're going to kill the patient. Tag the pump and then go find another one. You should not use the pump that is dysfunction with extreme caution. What does that mean at all? It's a trap. What is the priority action? Number 15, last safety and infectious control question. And then enter a client's room and see fire. There's fire outbreak in the client's room. What is your strategy to contain the fire? Activate the fire alarm, extinguish the fire, close the door to confine the fire, remove the client from the room. Which one would you pick? Safety question on fire. Fire, fire, fire. I can tell you the key is race. And if we're racing, number one, R is to rescue. Which one is rescue, people? Remove the client. 15 question. What is your score? Thank you for making it into 15. These are high yield. I've shown you ways to answer questions on safety and what? Infectious control. Now, let's get to med-surg. Med-surg, respiratory. Don't worry. It's high heater. It's very difficult. But there's a way you can understand the concept by looking at it, looking at the question, and going for the buzzword. So let's go. NS is caring for a client with chronic what? Obstructive sleep apnea, COPD. Which intervention is most important? What do you know about COPD patient? That's all. Encourage deep breathing and coughing every hour. Do you want them to take a deep breath and cough every hour? Give them what? Administer oxygen at 10 liters ml via non-rebreather. Position the client what? In a high Fowler position and restrict oral fluid. Stop the video. This answer choice is about content related to COPD. What do you know about COPD to answer this question? I can tell you this is the right answer. Upright, span the lung, they breathe, they get better. Why the other ones are wrong? Look, they need fluid to break down mucus and other things. Too much oxygen, 10 liters, is going to kill them. It's going to suppress them from breathing. Deep breathing and coughing every hour, excessive. You don't need all that. The nurse, how should the nurse interpret these results? ABG for the NCLEX. And nurse is reviewing arterial blood gas results for a client with COPD. What do you have? pH of 7.32, PCO2 55, and bicarbonate of what? 28. Which one can you interpret it with this? Uncompensated respiratory acidosis, partial compensated respiratory acidosis, fully compensated metabolic acidosis, and then metabolic alkalosis. What do you think? The best thing is to stop the video, pick your answer, and let me know. Like I said, these questions are hard, but I know you can get it because you watch Adapting class. How do you answer questions in ABG? Easy. Check Adapting class. Simple strategy to attack them. I'll show you a little briefly. Well, pH is less than 7.4. Therefore, it has to be acidosis. Alkalosis gone. Now, I have 3 acidosis. What is causing the acidosis? CO2 is what? 55. Yes, increase. If bicarbonate is causing the acidosis, it should go down. But it's still, it ain't gone up. It's higher than what it's supposed to be, more than 24. Therefore, this is a respiratory problem, CO2. I'm looking for respiratory. If it's a respiratory acidosis, what is the compensation? Metabolic, alkalosis. That means bicarbonate is supposed to go up. Bicarbonate has gone up. 28, but the pH is still 7.32. It's not 7.4. Therefore, this is a partially compensated problem, and it's due to respiratory acidosis. If you need more, like I said, check Adapting class. You will master your ABG, and that's the easy way to do it. Straightforward question. They can trap you. All these questions are pick basic concept and create a question around it and see how you're going to react. I hope you get over 65, which oxygen saturation goal is most appropriate. We just talk about this patient. The nurse is caring for a COPD patient is receiving oxygen. Where do you want their saturation to be? 100%, 96 to 100, 2 to 96, 88 to 92. Too much oxygen for COPD is bad. Therefore, where do you want it to be? The right answer is A. Just keep it low normal. That's where they live. They won't tolerate 99% oxygen. They can't tolerate it. The saturation 99, something is not right with them. And therefore, don't worry about it. That's your right answer. Which assessment finding indicate the client is improving, doing better. And this is caring for a client with what? Pneumonia. Pneumonia is infection. Therefore, if something is doing better, my infection should get better, right? At the same time, my oxygenation should get better. Respiratory rate of 28. Oxygenation 29, 90%. Decreased crackles on the auscultation. Productive cough with thick secretion. Which one shows I'm getting better? As usual, pick your answer. Let me know. And then proceed with the video so that we can continue. You pick an answer? I know which one you pick. I have pneumonia. Well, my respiratory of 28, it does not tell me whether I'm getting better. It's not really 100%. It may be the patient respiratory of 30. I never give it to you. So it's not effective. Saturation of 90. It may be good for him. Probably it was 74. Now it's 90. But it's not a good indicator. A decreased crackles on auscultation. Yeah, the bad problem with pneumonia is infusion. And if there's no fluid anymore, crackles, that's the best one. Productive cough and thick mucus means you still have pneumonia. Therefore, I like this one. No crackles. Decreased adventitious lung sound, indicating that there's a good airway clearance. Once again, decreased adventitious lung sound, airway clearance is good. Which observation require intervention immediately? A nurse is caring for a client with new chest tube connected to suction. Respiratory chest tube. How much chest tube do you know? Connected to chest tube. Which observation require immediate intervention? Gently bubbling in the suction chamber, tidally in the water seal chamber, intermittent bubbling in the water seal chamber, drainage of 250 ml in an hour. Which one, when you see in the chest tube, you know that something is bad? As I told you, the questions get harder and harder. But I know you know the answer. They are not hard. I'm calling it that way because that's the way you feel. But that is concept. Use the concept to figure it out. What do you see? When you see this question, the strategy is see the expected finding. If I don't expect this, that's your right answer. Immediate intervention means I don't expect this in this situation. If you have a chest tube, what should you see? Gentle bubbling in the suction chamber. The suction chamber is bringing suction in it. It's going to see bubbling and it's gentle. I'm good. Tidally in the water seal. Water going up and down here. It's telling me the lung is expanding. The system is closed. Intermittent bubbling in the water seal. Yeah, because they are probably pneumothorax. That's why the chest tube is placed. You have intermittent bubbling in water seal chamber. You're not supposed to see bubbling in water seal, but if you see it, it should be tidally. It should be bubbling. And it's intermittent. A drainage of 250 an hour, that's a bunch of bleeding. You got to intervene. Too much. Indication for surgery. This is a problem. We should intervene. Try the question so far. What is your score? How are you doing? What do you think? I know you're keeping up. Let's get to it. Respiration. We're going to finish this in a few minutes. Which intervention should the nurse anticipate? A nurse is caring for a client with what? Acute respiratory distress syndrome. Have you heard about it before? ARDS. Very good concept to know, and please love it. There's so many ways they're going to ask you questions about it, and I put it in this form. Which intervention should the nurse anticipate? You have to know the problem and what you should expect. And if you don't expect it, that's the answer. That's the breakdown of the question. High tidal volume ventilation, prone position, fluid boluses, sedation avoidance. If you have ARDS, which intervention should the nurse anticipate? ARDS, your lung is filled with fluid like a cake. It doesn't expand. There's increasing intrathoracic pressure, and your lung will blow up like a balloon. It pops like a balloon because it's too stiff. What do? We give you low tidal volume, not high tidal volume. If you remember what happened in COVID, when you go to the hospital, everybody is in prone position. This is what? Because they get acute respiratory distress syndrome. The best position to ventilate them is to put them in prone. If you give them too much fluid, it goes to their lungs. If they don't need sedation, you cannot put them in prone. You see how all connect together is concept. Prone position, best way. Which medication should the nurse administer first? A nurse is caring for a client with what? COPD experiencing acute exacerbation. Acute exacerbation of COPD. What do we want to do? Inhale bronchodilator, IV steroid, antibiotic, mucolytic. Go to the concept. I did not tell you what kind of COPD. It does not matter. It's a COPD. It's having exacerbation. What do you think you should do? You pick your answer? You know your answer? I know what you pick. And I can tell. Because how did you pick it? You pick bronchodilator. Why? You got to open the tube before you apply steroid. And therefore, a dilator is better than steroid. That is the first thing. I did not tell you they have infection. Antibiotic may be given later. Mucolytic to bring their mucus down. Also will be used later. But all of these medication cannot go to your lung until you open it out. And that's why you use bronchodilator. This one may feel a little bit hard. I will show you strategy to answer it. Long sounds can be very intimidating. But if you spend time and you master it your own, you see that it's easy. You can pick answer choice regarding long sound easy. Which long sound is the nurse most likely hearing? What is she hear? A nurse auscultate a client's lung and hear what? High pitch is very high. Like my voice. Musical sound. It sounds like musical, like my voice. Primarily during aspiration when you're breathing out. So think about it. The client reports shortness of breath. That's a trap. It's not necessary. The key is what? It's very high pitch and it sounds like a music. Is that wheezy? Is that ronchi? Is that crackles? Or plural friction rub? What do you think? You pick an answer? What do you think? Musical? High pitch? Yeah, during aspiration. That's asthma problem. You can see this is wheezy. It sounds like musical. What is ronchi? Ronchi is like you snoring, right? And friction rub is like leather rubbing against each other. And crackles is usually fluid. So you see the description, and this is the way to remember them. Crackles, fluid, ronchi, snoring sound, friction rub like a leather like rubbing each other, and asthma is like a musical, making music. That is the key. Which complications should the nurse monitor? I've given this answer away already. A nurse is caring for a client diagnosed with what? Acute respiratory distress syndrome. What complications should you monitor? And let me show you. This is your airway, and this is your lung, and this is your chest. In ARDS, the lung is so stiff. There's nothing going there. To put air in it, You got to use a lot of pressure. In the process, the intrathoracic pressure in your chest get bigger, 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 and it puts on your heart, and it squeezes your heart, and it causes all the problem. What complications should you worry about? Pulmonary embolism, respiratory acidosis, bowel trauma, hypotension, hyperventilation, metabolic alkalosis. What do you think? The lung is stiff like a cake. It's very difficult to put oxygen in it. What do you think? Because it's so stiff, when you put air in it, you can blow it up, pop it like a popcorn, and it can develop pneumothorax. That is barotrauma. And because the pressure is too high, it pushes on your heart. You have hypotension. You don't have pulmonary embolism. It has nothing to do with your vessel. Because you cannot exchange oxygen and CO2, you have respiratory acidosis. How can you hyperventilate if you cannot breathe? And there's no metabolic alkalosis either. So those are the things you should expect in a patient with what? Acute respiratory distress syndrome. Those are your answer choice. A nurse is caring for a client who reports greenish, green, productive cough and fever. It sounds like what? Infection, pneumonia, right? Which findings are consistent with the diagnosis of acute pneumonia. If I have pneumonia, what should I see? Crackles, head on auscultation, dyspnea and tachypnea. I have chest pain with words with breathing. I should have hypotension and bradycardia. I should have increased tactile fremitus, and I should have wheezing throughout the lung fields. We just listened to the lung sound. We just did lung sound. So you should be able to pick out the answers right away. But what do you think? I said the biggest thing about pneumonia is fluid collection. That's when I know it's getting better. So if there's no crackles and anything, it's good. Crackles, head in the lung is consistent with pneumonia. Your oxygen saturation goes down. You're going to have dyspnea. You're going to have related chest pain, expected finding. It does not affect your heart. You're not going to have hypotension. Unless you have sepsis, you can have hypotension and tachycardia, no bradycardia. Tactile fremitus, the area that you have consolidation, the thickness in that portion of the lung, when things go through, you can feel the vibration. That's what tactile fremitus. And you know, wheezing, that's the musical sound, goes with what? Asthma, not what? Pneumonia. Those are your right answer. Take a picture of it, go through it. You need to know pneumonia. They can ask you about case study, stand alone, because it's very, very common. Easy to make question out of it. How are you doing it? 25 questions. We've done what? Infectious control safety, and we finish respiratory NCLEX question, respiratory nursing, high yield. Now we're going to cardiology. Don't be disturbed. Cardiology is a baby. I see it as a baby. It's not that difficult. If you make it bigger, you will look bigger. It's little concept. You make a mountain out of it. So let's get to it. And the first one, I just said it, but I just want to challenge you. This is an EKG question without EKG. That means you can interpret the EKG without the EKG. So sorry if you get this wrong, but you will learn from it. Which rhythm should the nurse document? Document what rhythm? The nurse is reviewing a tele strip for a client. The rhythm show what? Irregular RR interval with no identifiable P wave. It sounds buzzy, a bunch of words, but there's key words there. If you put it together, the answer pop out like a candy. Irregular RR interval, there is no P wave. Is it sinus breathing, atrial fibrillation, ventricular tachycardia, first degree heart block? You pick yours? The thing said irregular. That means it's not sinus. Therefore, one is gone. Ventricular tachycardia is mostly ventricular rhythm. Therefore, it's gone. And therefore, you left with atrial fibrillation and what? First degree heart block. But they said there is no P wave. Whenever there is no P wave, it's AFib. That's the way to answer this question. And let's go for a client receiving IV furosemide for heart failure. This is cardiology, cardiac nursing, which finding indicate the medication is effective. This is a strategy. Don't get trapped with this question. If you get it wrong, just put it in the comments. Let me know. Because there's something here that you have to pay attention when you see questions like this. Patient has a heart failure. We give the patient what? What? IV furosemide. I want you to take care of it carefully. Look at it. Heart failure, furosemide, effective. What is the furosemide going to do that will make my heart failure get better? That's all. Is it going to increase my blood pressure? Is it going to increase my urine output? Is it going to reduce my pulmonary glucose? Is it going to increase my potassium? Don't get trapped. What do you think is going to do? Stop the video, pick an answer, let me know. You pick it? Good. I know you pick it. If you're not, pause it again. But this is the thing. At failure, we're trying to get fluid from your lung. How to get your fluid from your lung, we give you furosemide. How would I know it's getting better? When I listen to you, there's no more fluid. Crackles in your lungs. That's the best answer. This is a trap. Of course, furosemide will increase your urine output. Is that the reason why we give you furosemide? Don't pick it. If you pick it, then you ignore the effective in that question. Effective means something related to heart failure. There will be decrease in what? Pulmonary glucose. Increased urine output is what you expect from furosemide. Because of more fluid is getting out of you, we got to pee it, so it's increased. The blood pressure decreases, of course, your potassium decreases, so that's not relevant. But B is very, very important, and therefore the right answer is C. And next is caring for a client with heart failure who reports weight gain, right? Which finding is most concerning? How much weight gain should you gain in a very short time? That should be concerning to you. It does not matter. Usually, what? I'll give you the answer. It's a weight gain 0.5 kilos in 24 hours or 1 pound. Weight gain of 2.2 in 48 hours. Weight gain of 4.4 in 24 hours. Weight gain of 4.4 in 1 week. If you're doing the math, even if you don't know test taking strategy, you see how much is gaining within a short time is always a bad thing. The only two short ones are what? 24 hours. In one time, 24 hours, you get 1 pound. In one patient, you get 44. Which one will you get? And look at it. If in 1 week, you get 44, and 24 hours, you get 44, that will tell you this has to be the right answer. Nothing too hard. Same thing, EKG, without the EKG, just description of the strip. Which rhythm should the nurse identify? A nurse is reviewing ECG tracing showing regular rhythm, right? It's regular. The rate is 160, so it's a higher rate. And it's a wide complex. That means it's mostly QRS complexes. And there's no P wave. You see what it's showing? There's no P wave. No P wave, right? But it's mostly wide QRS. With atrial flutter, there's a bunch of P waves. Ventricular tachycardia, it's mostly wide QRS. There's no P wave. Ventricular, supraventricular tachycardia, there is P waves that is buried. Sinus tachycardia, there is P waves. Therefore, wide complex tachycardia is ventricular tachycardia. Which finding require the nurse to notify the provider something is bad? A nurse is caring for a client receiving what? IV nitroglyceride. It's a vasodilator. It's going to do something. You have a headache. You have a map of 50. You are flush in your face and the dizziness when standing. Remember, nitroglycerin, same side effect when you take it for angina. Therefore, if you gave in the patient IV and the report of headache, or you check their map is 50, they are flushing, dizziness when standing. Which one is your priority? You pick your answer. A lot of people I know what they're going to pick. They will pick headache, but that's not the right answer. They will pick dizziness, but they forget the word when standing, not all the time. The bigger problem is hypotension. If I put hypotension, you pick it. But when I put MAP, most people can't figure out. A normal MAP, mean arterial pressure is 65 to 110, right? 50 is really, really bad. That's bad hypotension. Patient is dying. And this is caring for a client with what? Left-sided heart failure. You know what is left-sided heart failure. What should you expect? Pulmonary peripheral edema, ascites, crackles in the lung, JVD, jugular vein distension. What do you know that should tell you this is left-sided heart failure? As usual, pick your answer, let me know. But I can tell you left-sided heart failure is what? Lung problem or forward flow. Do you see a lung problem there? Peripheral edema, that's systemic. Ascites, that's systemic. Crackles, oh, there's one lung. JVD, systemic. Based on that, which one do you pick? Make sure you pick the long one. Which finding are concerned is selected apply, and this is assessing the client in the outpatient clinic. And you see this, which one should worry you? Blood glucose is 140. Is that bad? Patient has two ulcers, cardiology problem. What do you think? He has shiny legs, skin, and there's no hair on the skin. You pinprick them, they don't feel anything. Negative pinprick test. The blood pressure is 130 over 65, and his skin is very cold and pallid. What do you think? Did you pick the answer choice? Which one should worry you if you're taking care of a patient with all these signs and symptoms? Which one should give you a pause and say, it's concerning? Select or apply. Don't over-select. Otherwise, you lose the point. If you know two, pick it and go away. But if you're a test-taking strategy guy and you know how to pick answers, well, pick it. But I want you to know, pick those you're 100% confident. Random glucose of 140 is okay. Anything less than 200 is fine. Ulcers, this is peripheral vascular disease, but I've not told you that. A shiny lower leg skin and a lack of air is also peripheral arterial disease, PAD. Pinprick test, it may be diabetic patient. Blood pressure is borderline, but it's not bad. And your skin is cold and pallid, I'm picking you. These are all bad problem associated with the peripheral artery disease. And this is the way they may present. How are you doing so far? 32 questions. Let's get to it. 33. This is a hard one. If you don't know, take a pen and paper, write whatever I say. Next time you will never mix it. To obtain accurate reading, at which location should the nurse level the pressure transducer? A physician just placed an arterial line for a client. The line was placed by the physician. Where would they place so that it can transmit accurate blood pressure? This is what we call A line. Put it at the second intercostal space mid-clavicular line, fourth intercostal space mid-axillary line, fifth intercostal space mid-clavicular line, sixth intercostal space anterior axillary line. What do you think? The best place is we call fibrostatic point. Fibrostatic point. I want you to write it down. Fibro. Then there is static. Static point. This is a point at the fourth intercostal space in the mid-axillary line. If you are above it, your blood pressure goes down. If you are below it, your blood pressure goes down. Therefore, you got to be exact at the fibrostatic point to maintain accurate blood pressure reading. And that's key. This is what we need. Concept mastering, adapting class way. Which finding should the parent be taught to report immediately? Selected apply. And nurse is providing district teaching to the parent of a child who underwent tetralogy or folate. What will you teach the patient? Always spend time to analyze the question. That's why I do that right away in front to let you know. Patient has what? Tetralogy or folate. Repair is done. What you tell the parent when they go home, they know the patient is having heart failure. Why? Because heart failure is the number one postoperative complication with repair of tetralogy or folate. Rapid weight gain, is that a problem? Heart failure, increasing fatigue, swelling of your face, hands and feet, dry intermittent cough and fever, and difficulty feeding. Which one do you pick to tell you that, hey, this youngster is getting heart failure? Go to your concept on fluid management and think about the patient you're dealing with, the population of patient you're dealing with. Difficulty feeding is classic for kids who are getting sick. Fluid retention will manifest in the face, hands and feet, facial hands and feet, periorbital edema, increasing fatigue, and the rapid weight gain. Cough is non-specific. Number 35. Which action by the new graduate require the nurse to intervene? They're doing something wrong. Doing something wrong. A new graduate is caring for a client who report discomfort, swelling, and redness of the leg. Which action by the new graduate require the charge nurse to intervene? The patient reports swelling, discomfort, redness of the leg. Do they have DVT? What do you do by the what? The new graduate that require intervention. The new graduate elevate the leg above the heart level, massage the leg, allow the client to walk to the bathroom, and place SCD on affected side. Which do you think is a problem? That when the new graduate do, you just have to intervene. Never massage that leg. Otherwise, it's going to embolize. It's a DVT. Discomfort, swelling, and redness is what we call DVT. And therefore, don't massage. Case study. Next generation case study. How are you doing? 36. Take a deep breath. I told you it's going to be difficult, but this is a practice run. If you haste this, you're doing good. You're not going to get the same test, but at least your concept is solidified. What do we have? Let's go through strategy to answer case study. When you go take the test, I want you to relax. When you see a case study, don't panic. This is your baby. Get on the, you can get 20 points out of one case study. Take a deep breath and say, I'm trying to figure out what is going on. How? Buzzword. First two sentences of the question they've given you. Let me show you. A nurse is caring for 68-year-old client who present to the emergency room with what? From the nursing skill facility with fever, 1, altered mental status, change 2, shortness of breath, 3, fever, change in mental status, and shortness of breath. Those 3 things, as you read down, connect the dot. Why fever? Why mental status change? Why shortness of breath? Whatever they say, go back and say, is that connecting to that 3 information? If not, ignore it. He has hypertension. It does not answer my question. Diabetes. He has kidney problem. I know this is past medical history. And so what? I move on. Fever. Oh, it connected to the fever. His blood pressure is low. Probably that's why his mental status. His heart rate is high. Mental status. Respiratory rate 22. Shortness of breath. Saturation is 90. It's not that bad. Patient is confused and disoriented. You have fever and confusion. Fever and confusion is something that when you combine it, fever, sepsis, confusion. What do you think? We are in septic shock. That's what is happening. Lung cause at lung basis. The skin is what? Warm and flush. Is that consistent with what the patient is describing? And look at the urine output after 2 hours is 20 ml. I'm not voiding. The VVC is 15. I have fever. My lactate is 4.8. It's more than 2. That's a problem. Your creatinine is 2.1 because you're not peeing. You have 20 ml in an hour. And your glucose is 198. And because you have diabetes. You see, we figure out what is the problem. You probably have some sepsis. That's all. That's all the problem. Now, the nurse has reviewed the clinical data, which finding in the client medical record are most concerning. Just go back and see which one. His lactate is 4.8. I can tell you it's high, usually less than 2. Blood glucose, a blood pressure of 88/52, that's hypotension. It's confused and disoriented, may be in shock. Glucose 98, 198, where he's diabetic. I'm not worried about it. And he's not making urine. 20 what? 20 ml per hour. That's the problem. So now we talk about this already. Based on the available data, which condition is the most concerned about? This is not hypovolemic shock. There's no evidence that he has lost fluid. There's no diarrhea, anything like that. He just what was involved with a condition that has what? Fever. That's all. So infectious. DKA, of course. It cannot be DKA. Therefore, this has to be septic shock because the patient has signs and symptoms of septic shock. What do you think? Acute respiratory distress syndrome. There's no evidence of that. We've already seen what you should have when you have acute respiratory distress syndrome. And therefore, this is not what we saw. And therefore, that's not part of it. There's no stiff lung. There's no any issue. This patient is just having signs and symptoms of shock. Which problem is the priority for this client? Impaired gas exchange, decreased tissue perfusion, risk for unstable blood glucose, acute confusion. He's already had acute confusion. His blood glucose, there's nothing wrong with it. Tissue perfusion and gas exchange, it has nothing to do with the lung. It's septic, therefore, tissue perfusion. Which prescription should the nurse implement? Select or apply. Draw a blood culture, give them IV fluid, broad spectrum antibiotic, oxygen, and then put a Foley catheter. This is the order you got. Culture, fluid, antibiotic, oxygen, and insert the Foley. Which one would you do? We're going to obtain the blood culture. Patient need IV fluid. We're going to give them broad spectrum antibiotic. What else? Do you think we should give them insulin infusion? Is that indicated in this situation? Is this indicated in this situation? What do you think? It's not. It's not having DKA. It's a septic shock. The glucose is not that bad. And we got to put a Foley catheter in because the patient is not peeing. Which action should the nurse perform first? Give them what? Antibiotic, oxygen, IV fluid, and blood culture. Remember, the previous one, let me go back. Previous one is asking what are the things we should what? Expect, right? What should be implemented immediately? These are the things we will do. It's not prioritization. Now the asking is among the four, which one will you do? Antibiotic, oxygen, IV fluid, and blood culture. This is a tricky one. Patient is in septic shock. The blood pressure is in the 80s. That's the problem, right? And tachycardia to 120, septic shock. Which of these would you institute? Stop the video and try it. But there's a concept here. Shock means hypoperfusion. If there's hypoperfusion, I should improve perfusion. How do you improve perfusion? Not oxygen. You give them fluid. And therefore, IV fluid is the first answer choice you should do. That's the first thing you would do. Blood pressure, you draw it before you give them antibiotic. So that's the way it goes. Updated data 2 hours later. A blood pressure is now improved, 104. Systolic. Its MAP is 72. It's normal. Its urine output is 45. Its lactate is still high. It should be less than 2. Which finding indicate that therapy is effective? Is it because of the lactate, its urine output, its MAP, or glucose? We know all of them is getting better, but which ones tell me that the intervention that we apply has done its job? The best thing to know about shock is to improve perfusion. Once again, which one indicate perfusion? Is the mean arterial pressure. I know a lot of people will pick urine output, but urine output is not sensitive compared to what? MAP. Your blood pressure is going to tell everybody or the MAP that there is actual perfusion. You may have urine output that is increased. Maybe the kidney is seeing more blood, but your brain may not. So global what? Mean arterial pressure is a clear indication of you are doing good. And that is it. And this is the end of the case. What do you think? Sepsis, septic shock. I went through all of the things that I know the NCLEX will ask you about septic shock. If you need more, watch this video again and write all the things. What do you need to do? Priority, which one you give first, and what is the indication of that? Thank you for watching. Are you ready? We are halfway. Question 37. Where do you think we're going? Take a guess. But look at what I'm going to do. Look at the first question. You see warfarin? What do you think? Pharmacology. This is high yield. Every medication we're going to talk about, I want you to write it down and know something about it. Which statement indicate correct understanding of the teaching? I'm just going with the short information about that medication. And then she's teaching the client about warfarin. I will eat more leafy vegetables. Is that okay? I will use electrical razor. I will stop the medication if I bruise. I will need what? Daily labs. Which one do you think? Correct understanding. You don't need daily labs. At least, usually twice a week. Daily is too much. You shouldn't stop if you have a bruising. You should use electric shaver, and you should not eat more leaves, green leaves. Bad. And this is administering insulin glargine, insulin therapy to a client, which when should the medication peak? When you give somebody insulin, there's a place they will develop hypoglycemia. And that's the point they peak. And that's the time you see them to observe for hypoglycemia. Glargine, when do I go? 1 to 2 hours, 4 to 8 hours, 4 to 6 hours, 8 to 12 hours, no pick. You pick your answer. Which one did you pick? Stop the video as usual. This is a trap. Glargine, no pick. Therefore, nothing to worry about it. Which allergy is most concerning? This is also trapped by a very strategically placed question. And this is administering ceftriaxone to a client. Which allergy is most concerning? I want you to apply your clinical knowledge. This is antibiotic pharmacology. When they give you a medication, ceftriaxone, which antibiotic or which allergy should you worry about? Patient and shellfish allergy, penicillin allergy, latex allergy, sulfur allergy. This is a trap. But to test your critical thinking, you pick your answer choice. I know you pick. Ceftriaxone, what? They have cross reactivity with penicillin group. Therefore, if you are allergic to that, I should check if you are allergic to penicillin. I don't care about shellfish, latex, or sulfur. This is the most important. Which findings suggest digoxin toxicity? That means bad things is happening. And this is monitoring a client who's receiving digoxin. Therefore, if they have bradycardia, does it mean toxicity, hypokalemia, vision changes, hypertension, bounding peripheral process, increased appetite? What do you think? When you have GI symptoms, it may increase toxicity, but appetite increase is not one of them. It should be decreasing. If your process is bounding, you're doing good. Hypertension is borderline. It does not tell. But yellow vision change, problem. Hypokalemia is a risk factor, but it does not indicate that you are having what? Toxicity, digoxin toxicity. Understand, it's different. A risk factor for toxicity is what? Hypokalemia for digoxin. But to show that you are having toxicity, vision changes, and what? Bradycardia, because it causes heart block. Which action are appropriate? Selected, apply, and nurse is preparing to administer promethazine. This is pharmacology, English practice question, English questions and answers, 85 questions to test your knowledge to prepare you for the NCLEX exams. What do you think? Promethazine, this is safe medication administration and that. Which actions are appropriate? You have to know how to administer promethazine. Avoid IV push administration, administer deep subcutaneously, monitor the IV site closely, give rapidly for nausea relief, dilute and increase slowly to prevent hypertension. This is one of the questions I did regarding safe medication administration and medication. You should never push IV fast. Therefore, this is not appropriate. Avoid IV push. Therefore, this said avoid it. So that's good. If you IV push, it's a problem. So which actions are appropriate? Never IV push. Therefore, you should avoid IV push. You should give it IM, not sub-Q. You should monitor IV site if you what? Give it to IV to prevent necrosis. You should not give it rapidly because it can cause problem. And it can diffuse and infuse slowly, but it does not cause hypertension. This was a trap. I put it there because I know a lot of people will pick it, but it does not answer the question. The first portion is right. Hypertension has nothing to do with the medication. Which medication should the nurse expect to be prescribed? I love this question. A nurse provides care for a client who is experiencing acute panic attack. So if you're having panic attack right now, which medication should I give it to you? Buspirone, escitalopram, sertraline, lorazepam. Acute what? Panic attack. We got to bring you down. We need anxiolytic. Which one of this is anxiolytic? You see, I'm giving you strategy to answer question. I break down the question and say, I need anxiolytic anxiety medication. Which one? Buspirone is anxiety medication. Escitalopram is the anxiety medication. Sertraline is the anxiety medication. Lorazepam is the anxiety medication. Which one would you pick? You pick your answer? I can tell you, Lorazepam. Why? Buspirone is anxiolytic, but it's atypical. It cannot act right away. It takes time to work. This patient is having anxiety right now. I need something that is fast acting that can get out of the system quickly. Escitalopram and sertraline are SSRI. They can be used for anxiety, but not first line. 43. Which instruction should the nurse include when teaching the client about this medication? Selected, apply. The nurse is prescribed hydrochlorothiazide for the treatment of what? Hypertension. What should you include about this medication? Rise slowly from a sitting or laying position. But that means you're teaching them to prevent what? Orthostatic hypertension. Restrict intake of potassium-rich food. You don't want them to eat too much potassium. Monitor for dizziness or lightheadedness. Is that okay? Avoid the use of Salt substitute. Why should they avoid it? Report muscular weakness or cramp. What do you think? I know you stopped the video. Which answer choice did you pick? What do you think? Yes, orthostatic hypertension, rise slowly. You should not restrict potassium because hydrochlorothiazide will lead to low potassium. You need to improve your potassium. You should monitor for dizziness. Salts substitute contain potassium. So if you avoid them, that's the problem. Report muscle weakness and cramp. That means hypokalemia symptoms. That's the right answer. You see how the content connect together. And that is the idea of this 85 question. You can see a full play. And when you go take the test, go to that mood. Put it together. They're not going to trick you. If they give you something straightforward, that's what it means. They've given you all the things you need to answer. It's not tricky. That's what I'm doing is short information, connect each one of them. You said, oh, I have everything. Like this one, which finding indicate the client is experiencing adverse effect, bad problem. And then provide care for a client who has received what? Vancomycin IV for what? MRSA. So you have MRSA infection, you get vancomycin. Which one tell me you're doing bad? Your heart rate is 85. Your temperature is 101.5. Your white count is what? 13,000. You have decreased glomerular filtration rate. Which one? This is a trap, right? If you think about it, it's a trap. If you don't take care, you get it wrong. But I don't want you to get it wrong. I want you to think fast and try to get this answer choice because I believe in you. I want you to get this one. I would like everybody to, if you get here, put your answer down. Number 44, which one did I pick? Let's break down the question. Patient is receiving what? Vancomycin for MRSA infection, adverse effect. Vancomycin, your hearing, and what? Your kidney. It's always a problem. Heart rate of 85 has nothing to do with it. You have MRSA. I expect a fever. You have some fever. Your white count is going to be high. It's unrelated to vancomycin. What causes vancomycin problem is your kidney. GFR is a problem. Your GFR is decreased. That's a problem. It's the same thing as your creatinine is increased. And this is your priority that you should intervene. See, the knowledge is being applied. This one is hard, but it's not. Like I told you, pharmacology, a bunch of pharmacology are put it together so that you can apply your knowledge during medication review at the clinic, which client statement indicate the nurse needs to intervene. That means I need to intervene. Something is not right. A client with what? Hypertension take atorvastatin and drink large amount of grape juice. A client takes alendronate first thing in the morning on an empty stomach with water. Should you do something? A client taking warfarin report eating large amount of green leafy vegetables. A client taking doxycycline mentioned that they are planning to take antacid at the same time. A client with asthma uses over-the-counter with acetylcysteine for cough. What do you think? Which one we should intervene? That means the drug-drug combination is a problem. That's our question. That's what he's asking. Did you get it? Which one? Atorvastatin, drink large amount of grape juice. Should we intervene? Should we intervene? The client take alendronate first thing in the morning on an empty stomach. That's good. A client taking warfarin report eating large amount of green leafy vegetables. That's a problem. Right. So a client with hypertension take atorvastatin, drink large amount of grapefruit juice. Atorvastatin is the starting. Starting should avoid grapefruit juice. That one. Alendronate should to take what? Your medication early in the morning in an empty stomach. Excellent. Warfarin, you should not eat large green leafy vegetables. Intervene. Doxycycline should avoid antacid. It affects absorption. In asthma patient, acetylcysteine will give you cough, causes bronchospasm, you have a problem. This is consolidation of pharmacology. If you get it wrong, understand, put it together, and let's taste this test. Same thing, if you couldn't get it, this one I want you to get it. While reviewing a new client medication, which statement indicate the nurse should intervene, select and apply. This is our pharmacology, high-yielding pharmacology to test your knowledge. A client taking levothyroxine states they take it with breakfast. Should you eat with by taking levothyroxine? Simvastatin mentioned recent pregnancy. I'm pregnant and I'm taking what? I'm pregnant and I'm taking what? Statin. A client taking 1,500 milligrams of calcium says they divide the dose into 3. That means when you're taking 1,500, do you take it at once or you divide it into 3? A client taking lisinopril report occasional cough. A client taking omeprazole report that they take it 30 minutes before they eat. Is that a problem? A client taking insulin Glargine report taking the medication without meal. Which one did you pick? Which one did you pick? Which one need intervention? Levothyroxine, take the medication, empty stomach. Statin, if you're pregnant, you need to stop it. 1,500 calcium, take it in divided dose. This is good. Lisinopril, if you have occasional cough, it's a problem, but not immediate intervention. Should not intervene. Omeprazole, take it 30 minutes before meal. That's good. And insulin Glargine, you don't need to take it with food. So that's all good. This is pharmacology. Testing you. They are hard questions, but designed to help you pass. What do you think? Where are we going? And this is caring for a client on a teleunit. Which client should the nurse see first? We move to prioritization. By stopping the video and answering it before you, let me give you the answer. A client with what? Atrial fibrillation, his heart rate is 88. A client with sinus tachycardia after ambulation. A client with ventricular tachycardia on the monitor. A client with premature arterial contraction. Who you have to see? That means who does not have time, who may die. I can tell you, right answer is V-Tach. V-Tach is bad. If he has no pulse, it's pulseless V-Tach. That's V-fib. You got to shock him. Sinus tachycardia, when you walk, it's like walking and you get tired. Your heart rate goes up. Atrial fibrillation, I don't care. Your heart rate is 88. It's good. Premature atrial contraction is the warning sign. Don't worry about it. Which client should the nurse assess first? In the emergency room, you have 4 pediatric clients, 4 babies, pediatric clients. One has barking cough with mild contraction. Patient is in tripod position in his drooling. He's diagnosed with whooping cough and is alert. He has wheezing and shortness of breath. Bad kids problem, pediatric. But I want to work your way through so that when you see them, you say, oh, I know, adapting kids training well. What is the right answer? This is a preglottitis. Tripod position, drooling, preglottitis. Barking cough is bad, right? And whooping cough. They are all respiratory pathologies in pediatric patients. But epiglottitis is the biggest problem. Asthma patient is number 4. Wheezing and shortness of breath. But if you have in the tripod position drooling, you are about to die. We got to see them. And let's receive report 7 client. Which client should the nurse see first? Same thing. The client was admitted yesterday with pneumonia. What is his oxygen? He's on 2 liters. Client hospitalized yesterday. He has type 1 diabetes. His glucose is 160. This one was admitted earlier on with postoperative appendectomy. He just had surgery. And a client is 2 hours ago. He has acute GI bleed. He's bleeding and his heart rate is 102, 101. So acute GI bleed 101, just add appendectomy. He's type 1 with his glucose of 160 and his pneumonia 2 liters. You pick yours? You waiting for me? I want you to pick yours. You pick it, I see you. Thank you for doing that. Put your answer in the comment. But I can tell you, this guy is in shock. The rest, they're also in trouble. Post-op patient, you got to check on them quickly. Type 1 diabetes, sugar is not that bad. Pneumonia, 2 liters is not bad. Who should be assessed first? Nurse is caring for this assigned client. Who would you see? Patient has hypertension, blood pressure is this, and is scheduled to receive Vancomycin. I'll show you how to answer this kind of question. 3 information, sometimes 4 in the question. Patient has stroke 3 days ago, is alert oriented, is scheduled to receive clopidogrel. You see the way I read it so that I can understand the question. He has abdominal surgery 1 hour ago. There's a sudden severe abdominal pain. It should not happen. And he has abdominal distension. What do you think? Pneumonia 101 is scheduled to receive cetirizine. Which answer choice you pick? This is challenging one. But which one did you pick? I want to see which one you pick. You pick your answer? Okay, thank you very much for doing that. The way to answer this kind of prioritization, 3-in-1 prioritization, say, oh, I have hypertension. This is blood pressure. It needs lisinopril. He has time. His blood pressure is not bad. Right? He had stroke 3 days ago. He should be stable. He's alert. And he's scheduled to have clopidogrel. This is routine medication now. He had surgery 1 day ago, but there's a boom, all of a sudden, abdominal distension on situation that you don't expect to happen. If you have pneumonia, you're going to have fever and you need antibiotic, we'll give it to you. Therefore, that patient is in trouble. Surgery with acute onset of what? Abdominal pain and distension. That's a problem. How many have you got so far, this prioritization? What do you think? The wording, the language, and the condition. Let me know in the comments. Which client should be seen first? A nurse in the medical surgical unit has just received report, 4 of them. What will you see? Client fell, client on 4 precaution, who requests assistance to get out of the bathroom. He want to go to the bathroom. Client who has asthma is using rescue inhaler every 2 hours. Client has hypertension and his blood pressure is 178/96 and we report headache. If you have femur fracture, you have petechia over the hard palate. Which of these 4 patients should give you a pause? You should do something right now. You should intervene right now. Otherwise, if you don't, we have a problem. Strategy, prioritization. You got to be sharp. What is the sharp? Breathing issue, electrolyte, shock, sepsis, airway, lethargy, pain that will kill you. 4 precautions, safety issue, right? Requesting ambulation, nothing to worry about it. Asthma is using rescue inhaler. It may need some help. You look like you're using more often. Something is not right. You have hypertension and you have headache, neurological symptoms. We got to intervene. But if you have femur fracture and you have petechia on your hard palate, that means you have fat embolism. If you don't do anything quickly, you're going to die. That's the patient we should see. Did you pick that one? I know you pick it because that's the most dangerous patient on the screen. Which client should be assessed first? 2 days post hip. They are all orthopedic units. We receive a report in the orthopedic unit. Who should you see? Hip replacement, temperature is 100.4. Does he have infection? I don't know. Wrist fracture, he has what? Cast place, and he has severe itchy under that. He has long bone fracture, and he's in traction with pains, and his toes is cold completely. Client with the pelvic fracture is reporting dizziness and blood pressure of 88/54. Which of these conditions should concern you? Which one do you think is a problem? Stop the video, put down your answer, let me know. But pelvic fracture with dizziness, that's hypotension, right? Long bone fracture, I have severe pain. And what? Cold foot, what do you think? There's numbness and tingliness under the calf. Therefore, which one would you pick? That's all. Which one would you pick? This one is bleeding. So, is he in shock? Maybe. But this one, there's evidence he's losing his feet. This is compartment syndrome. He's probably developing compartment syndrome. If you don't do anything, he's going to lose his leg. Wrist fracture, he has a cast, fine. But what is the problem? Itchiness under that. Therefore, that's good. These are little things when you think about it, when you do prioritization, you know that you're doing something good. Which client should be assessed first? Same thing. And next in the medical surgical unit received report on 4 clients. We have a client who's hypovolemic shock from GI bleeding. His blood pressure is 82/54 and heart rate of that. That's shock. Client with septic shock, secondary to what? Urinary tract infection. This one was due to what? GI bleeding. His temperature 100.2. He has heart rate and that. So his UTI problem, this is GI bleed. Anaphylactic shock, we all have shock. After what? A brain stain reporting what? Dyspnea, facial swelling, and wheezing. A client with cardiogenic shock post-op with a blood pressure hypotensive, tachycardia, cold, and climbing skin. That means a bunch of shock patients with different signs. What do you think? You pick an answer. Who is in trouble? They all have shock, hypovolemic shock, septic shock, anaphylactic shock, cardiogenic shock. But I can tell you any shock that affects your airway, I'm picking you. This anaphylactic shock causes bronchospasm, airway constriction. That's a problem. We should see that patient. An emergency department nurse is assigned to triage. Who do you think she would triage? A client with acute onset of slap cheek rash and fever. Probably B19. Client involved in house fire with scent air on the face. Airway inhalation. Client with casted leg 24 hours ago, he was reporting severe pain. He's going to lose his leg. Client with acute onset of what? Periumbilical pain radiating to the right lower extremities, right lower quadrant, and anorexia. This is the patient you have. Slap cheek rash, house fire with scent air. What is that? Casted leg 24 hours ago with pain, and a periumbilical pain radiating to the right lower leg. Which answer choice you pick? That's all. Which answer choice? Who do you think is in trouble? I can tell you this is airway. Inhalation injury. That's the way we call it. Scent air. When you see that, that's what it means. Of course, we worry about the casted leg is going to lose their leg. Most likely it's compartment syndrome. But it will be alive compared to the other one. Its airway it will be compromised shortly. That's the patient we're going to see. Which client should be assessed first? Like I told you, this prioritization is to shake you. And next in the medical surgical unit is assigned 4 clients. Come back to them, keep on watching them. Client who had seizure, he had seizure 30 minutes ago. What do you do? Client with asthma and status asthmaticus. Client with CHF exacerbation. Client with acute, what? Rigid abdomen and a severe abdominal pain. That's a problem. But who should we see? You have a seizure patient happened 30 minutes ago. Asthma patient who keep on seizing multiple times. Heart failure patient We may be having exacerbation, and then sepsis, rigid abdomen, and severe pain. That's what it means. You figure it out, you pick an answer. I can tell you, what do you think? This guy is having airway problem. This guy had seizure, is going to recover from it. CHF exacerbation may have what? Respiratory issue. But asthma, airway is mostly airway. CHF patient is a breathing issue. The airway trumps that. And that's why we're going to pick B. Sepsis, I know, rigid abdomen and severe pain, but we're still going to honor picking what? Asthma patient with the airway issue. Delegation. What do you know? I know you know it. I know you mastered it. So show it to me. LPN is assigned by RN to administer IV antibiotic to a client with severe sepsis and temperature of 102 and a blood pressure of 82/50, which action should the LPN take first? Administer the IV antibiotic as assigned. Ask another LPN to witness the IV antibiotic instead. Notify the RN that the assignment is unsafe and should not be performed. Complete the task quickly and report the outcome to the RN. This is delegation, scope of practice, proper situation, right person. What is happening? LPN said, you give me a patient who's not stable, sepsis, temperature, hypertensive. I can do it. That's the thing. I am not doing it. Assignment is unsafe. You don't refuse it, but you say it's unsafe. Therefore, go away. Which task should the nurse delegate to LPN? Same thing. MMR most. Most medication, monitor, reinforce, no teaching, no evaluation, no assessment. That's the thing. I've given you all the scope of practice for LPN. Administering scheduled medication to a client, measuring a client blood pressure, helping a client with brushing their teeth, assisting the client with ambulation to the ballroom, performing client sterile dressing change. What do you think? You can give medication. Measuring client blood pressure is done by the UAP, not LPN. There's a UAP there. Helping the client to brush their teeth. There's a UAP there. You can give it to the UAP. Assisting the client to ambulate to the bathroom. UAP is there. I can change the sterile dressing. The rest, UAP can take care of it. Which delegation principles is being applied? LPN, who has 1 month of experience, is asked to administer intramuscular pain medication to a post-op client. Another LPN with 1 year of experience is assigned to monitor what? A client receiving IV fluid. One is watching for IV fluid. One is administering specific medication. Which of these principles is being applied? Right task, right person, supervision, and communication. I can tell you this is not right communication because it looks like they're not arguing, agree with each other. There is no supervision here. It's the task assigned to you. Do it. That's all. So that's the situation we have here. What is the problem? The nurse is trying to portray the RN right person. If you're good at what you do, we're going to let you take care of the patient just like that. And that's the key aspect of it. So this is a right patient based on the concept. A nurse is preparing a client for discharge. Patient is going home. Which tasks are appropriate to delegate to the UAP? I'm going home. You send a UAP. What can UAP do? Of course, he cannot give me a discharge teaching, but there's something they can do. Measure the client vitals before they leave. Provide the client with the bedside teaching on medication administration. assist the client with packing personal belonging, helping the client to walk to the street after discharge, reviewing dietary instruction with the client. What do you think? Which answer choice you're going to pick? Measuring their vitals before they leave is good. Providing the client with bedside teaching on medication administration, that's irrelevant. Assisting the client with packing personal belonging, that's assistant. Helping the client to walk to the car, ambulation. You cannot review any diet instruction with the client. This is what you can do, Mr. UAP. Which statement by the nurse reflect appropriate delegation? Same thing, we're on delegation of the NCLEX. Which one? A nurse delegate care for a client with stroke to the LPN. You have stroke. If I see you doing this, is that appropriate? Perform a complete neurological assessment every 2 hours. Is that appropriate? Administer the scheduled oral medication and report any difficulty swallowed. Develop the client care of plan for impaired mobility. Teach the family how to prevent aspiration during meal. This is the concept regarding what? Delegation and assignment. Which one is appropriate to be delegated to the LPN and which action is appropriate for them to take? There's no need to perform complete neurological assessment. They don't do that. They can give oral medication. They cannot develop the plan of care. And they cannot treat the family how to prevent what? Aspiration lung fails. Unless they reinforce in the teaching. Which action by the nurse is most appropriate? A nurse is caring for a client experiencing postpartum blue. You see what I did? I just flipped the switch on you. You're on maternity nursing. Stay awake. Put it together. Almost done. English practice question. English questions and answers. English review questions on what? All the things you need to know for 85 regarding pharmacology, peds, anything you need, cardiology. Now we're on what? Maternal health. And nurse is caring for a client experiencing postpartum what? Blue. Which action by the nurse is appropriate? Recommend antidepressant, encourage rest and reassurance, notify child protective service, recommend hospitalization. What is this? I can tell you the right answer is what? Rest and encourage them. Most of the time, they don't need a medication, they don't need hospitalization. That is all you need to know. Unless it gets worse to depression, yes. But most of the time, encourage rest and reassurance will help with postpartum blue. MS is caring for a client experiencing mania. What do you think? Bipolar patient. Do they have, which one is the most important and concerning? Pressure speech, grandiosity, psychomotor agitation and hyperactivity, and disheveled appearance. Which one do you see in the patient bipolar should give you a pause? You should worry that something bad is happening. You should worry that I need to intervene. What do you think? Is it pressure speech, grandiosity, psychomotor agitation, hyperactivity, and disheveled? Go to the content. Look at the mania. What do I see in mania? Everything is up. Therefore, pick an answer choice that is up but not expected finding. Pressure speech, expected. Grandiosity, expected. Psychomotor agitation, expected. And therefore, disheveled appearance is not. Which intervention should the nurse anticipate? Remember, this is talking about what? Most concerning. When you see disheveled appearance, I need to explain it. It means they're not taking care of themselves. Self-care is neglected. They're not hydrating themselves. They're not eating. And therefore, we got to take them and feed them. Which intervention should the nurse anticipate initially? A nurse is caring for a child with what? ADHD. The kid has ADHD. Which intervention should the nurse anticipate? Do we give them medication right away, methamphetamine? Do we send them for behavioral therapy? Do we complete neurological assessment? Do we place the client on a special needs class? What do you think? When you have ADHD, like any other condition, you have time. You don't have to take medication for everything. Behavioral therapy, control them. If they get agitated, give them something so that they can deposit their agitation there, but you're able to manage them until you cannot. But you don't start with medication anymore. Therefore, behavioral therapy. Which nurse action indicates the working phase of nurse-client relationship? Select or apply. The nurse care for several clients on a mental unit. Which one? Encourage a client to discuss feeling about recent relapse. Explain unit rules and daily schedules to a newly admitted client. Teach a client coping strategy to managing anxiety. Assist the client in identifying realistic treatment goal. Summarize progress and discuss discharge plan with what? Client. What do you think? The key word in the question is what? Working phase, not the end. Working phase. You meet the patient, you introduce yourself, and you start working. After you work a very long time, then you go to the retire phase. In the working relationship, we are implementing all the things the doctor wants us to do so that I can get you back better. Therefore, what do you think? Which one is the right answer? Encourage the client to discuss their feeling. This is therapeutic. It's not the end of the game, but we're getting there. So encourage them, talk about it. Explain unit rule, daily schedule to newly admitted clients. That's the beginning. We are not working together. When you're explaining rules and everything, that's wrong. It's a trap. We are not working together. Teach a client coping strategy. Yeah, I'm teaching you so that you can get better. Assist a client. I'm assisting you so that you can get better in identifying realistic pathway goals. When you summarize progress, you discuss discharge. That's the end of it. So know the working relationship, nurse-patient relationship. There's so many things you have to know. At the working phase, usually you're trying to be therapeutic, things that is going on to fix it before you get to the next stage. A nurse is caring for a client in inpatient mental health unit. Which nursing action, a boundary crossing in the nurse-client relationship? That means we're crossing boundary, things that we're doing that we should not do in the patient relationship situation. Sharing personal experience with anxiety to help the client feel understood. Encourage the client to discuss their feeling during a scheduled therapy session. Maintaining a calm tone while redirecting inappropriate behavior. Documenting the client progress towards treatment goal. Which one indicate we are crossing boundary? That means we're doing things we're not supposed to do. Sharing personal experience. There's nothing better about it. You're using personal experience with anxiety to help a client. No, you can't do that. The rest are fine. You can't do that. Case study. Are you ready? This one is not that difficult. You've seen it before. It's just in the case. Go get it. Go pick out the words from it. I show you the strategy. First two sentences. Pick the buzzword and run with it. Nurse caring for 24-year-old. Admitted to the emergency room. 1. Polyuria. 2. Polydipsia. Nausea. Abdominal pain. you know what it is. The client has history of what? Type 1 diabetes. This is reinforcing it. And the reporting missing is what? Insulin dose 2 days ago. This alone, you should make a diagnosis. Polyuria, polydyspnea, nausea, abdominal pain in a diabetes who's not taking his medication. Straightforward. And you don't want to trap you. This is all you have. I give you his past medical history. Not bad. His blood pressure is hypotensive, tachycardia as expected. And his smell fruity. Something is wrong. His skin is dry. You see dehydration. You check his glucose. Way high, over 500. pH 7.15. That is what? Acidosis. Bicarbonate is 12. That means it's what? Metabolic acidosis. Potassium is elevated as expected. These are things that is happening. You can figure out the case. You can see just by reading it, you get an idea what they're trying to do to you. Did you figure it out? Yes. Which finding are most concerning for the client's condition? Well, blood glucose is too high. He has Cushman breathing, deep rapid breathing. He smells fruity. His pH is acidotic. He's hypotensive. All of them bad. Which acid-base imbalance does the nurse identify? Well, what do you think? This patient, blood gas, pH is 7.15 acidosis, who is responsible? What do you think? This is DAK. What are they going to show? Metabolic acidosis. Which problem is the priority for the nurse? Is it electrolyte issue? Is it decreased tissue perfusion? Is it hyperglycemia or acute pain? What do you think? Which one to bother you? Which one? It's the same question we saw with sepsis. The patient is dehydrated and everything. In the process, tissue perfusion. They go into decay, they go into basically hypovolemic shock, therefore decreased perfusion. You receive these orders. Sodium, normal 7.9, what? Regular insulin, monitor serums, electrolyte, cardiac monitoring. Which of these would you do? Which prescription should the nurse implement, select or apply? Initiate IV fluid, start insulin infusion, administer potassium supplement, place on what? Cardiac monitor, and administer sodium bicarbonate. What do you think is going on? What do we think is going on? Did you figure it out? I know you figure it out. I know you figure it out. We're going to start IV fluid because this patient is in decay. Classic, right? We're going to start insulin because you are in decay. We're going to replace your potassium. We're going to place it in what? Cardiac monitor. That is the key. Which action should the nurse perform first? DKA patient. You're giving them all the things. Now put everything together. We give them what? IV fluid. We give them insulin. We're going to repeat their blood glucose. And if they get to a certain low, we give them potassium. But for now, what will you do first? What will you do? Give them fluid. Fluid for DKA and save the individual. Which finding indicate the client is proving? There should be no more DKA, no more K, DKA, no more A, DKA. What do you see? Ketone is present. We still have a problem. Houston? Respiratory of 28. Not bad. Bicarbonate of 20. That's acidosis. Blood glucose of 320. We still too high. Therefore, which one indicate client is improving? Tell me. There's ketone there. I don't like it. You're breathing too fast. Bicarbonate, I'll pick the 20. It's not bad. 20 to 24 is really normal limit. This is what we'll pick. And this is all the things you need to know about DKA. If you need more, I want you to watch this video multiple times, this section, and know these are the questions they will ask you. We have 10 more questions and then we're done. But these are high charging, fast information I want you to know. So buckle up, let's go. Maternity, straightforward, a bunch of subtle questions. Select or apply, which finding that the nurse expect in this client. And nurse provide care for pregnant client diagnosed with pre-eclampsia, proteinuria, illness, seizures, hypertension, and reflexia. We've seen the patient with pre-eclampsia, which finding should be what you should expect. Pre-eclampsia, stop the video, pick an answer choice. But pre-eclampsia, supposed to see protein. You see clonus, which is what? You see high form of, in severe form of pre-eclampsia. If I see seizures, you progress to eclampsia. If your blood pressure increase, hypertension is the diagnosis of what? Pre-eclampsia. In reflexia, you see it when the individual is receiving what? Magnesium. We are not receiving magnesium yet. Which finding require the nurse immediate intervention. And nurse is caring for a pregnant client with severe pre-eclampsia receiving what? Continuous infusion of magnesium. That's the question. I'm getting magnesium. Which one should intervene? Everything goes down. That's the buzzword. Everything goes down. Blood pressure 168/102. That is the diagnosis of pre-eclampsia. Presence of ankylosing. Think about it. Absence of deep tender reflex. Think about it. Urine output of 35. Think about it. Which one should we intervene? Your urine output is okay. The blood pressure is high, severe, but now we're left with B and C. Which one would you pick? The thing is, I'm receiving infusion of magnesium. I should intervene. Presence of clonus is a good sign. It means you're not having seizures. It means you have severe preeclampsia. If I don't see what? Deep tender reflex means you have what? Magnesium toxicity. And that's the problem. NSTG is a class of contraception, pharmacology of maternity, which client statement require follow-up teaching, select or apply. I should take my combined oral contraception pill at the same time every day. I will keep my vaginal contraceptive range in for 4 weeks. I will cut down smoking while using estrogen-containing contraceptives. I will be protected from sexually transmitted infection if I use birth control pill. I will need emergency plan B pill within 7 days. Which one require follow-up? That means they're saying something bad. That's all. This is contraception. I put all together to give you the content, one video, content about things you need to know about contraception in one question. Take the contraception same time every day. That's good. Your vaginal contraceptive ring should be kept in 3 weeks and remove it. Then you can bleed the next week. So we needed to intervene. You should stop smoking. Don't cut down smoking. So oral contraception does not protect you from STD. And plan B, you need to take it 72 hours, not 7 days. That's the question. That's the concept over there. That's the answers. This is the high yield maternal health pharmacology for pregnancy. Pregnancy medication, antihypertensive for what? Maternity. Which medication in the client's medication list should the nurse question? A nurse is caring for a client with chronic hypertension and lupus, who is what? 4 weeks pregnant. He's 4 weeks pregnant. He has lupus. He has chronic hypertension, and he's taking what? This medication, metoprolol, labetalol, metadopa, nifedipine. Which one do you think? Which one? All of these medication can be used in pregnancy to treat blood pressure. But there's one that causes lupus, mitadopa. If it causes lupus, why would you give it to a patient lupus? The next you intervene and say, well, we should need to stop the medication. You already have lupus, so we should not give it to you. Which intervention should the nurse implement first? A 2-year-old, right? This is pediatric. Is brought into the emergency room with what? Barking cough, back problem, pinch respiratory, stridor, back problem, at rest, mild retraction. The oxygen saturation is 93%. So we have what? Cool. Which intervention should you implement? Administer nebulized epinephrine treatment, start IV antibiotic, encourage the child to lay flat and rest, give oral antitussive medication. Barking cough. They want to clear their what? Secretion. You should not prevent them from coughing. This is wrong. They should not lay flat if you're having respiratory problem. You need to open the airway. That's what we do in this stridor. You need epinephrine to open the airway. That's the key before they need antibiotic. A nurse is caring for a client diagnosed with what? Phenylketonuria, PKU, pediatric. Which action is most important to prioritize? This condition, they cannot metabolize certain amino acid. So give them what? Enzyme to help with it, or don't eat the amino acid. That's all. If you watch a video, last video will talk about this, but one sentence I've given you everything. Instruct the family to provide low phenylalanin diet using special formula. Encourage the client to increase protein intake with lean meat and dairy. Monitor the client for signs of what? Vitamin B12 deficiency. Schedule routine neurodevelopment assessment. You see how I give you so many things that is irrelevant. The questions say I have PKU. Try to not to eat anything that will make your disease worsen, right? Therefore, instruct them to take low phenylalanin because you cannot break it down. You cannot just not eat protein, but make sure there is no PKU in it. Which strategy should the nurse implement? Select and apply. And nurse provide feeding education to a parent and infant with cleft lip. Cleft lip, there's a strategy you can feed the patient. Otherwise, they're going to aspirate. They're going to have a bunch of gas. You got to deal with it. Use specialized nipple. Feed the infant in upright position. Burp the infant frequently. Allow the infant to feed laying flat. Feed slowly and allow rest period. What do you think? Use a nipple that is specialized because of the cleft lip. And feed them in upright position, just that they don't aspirate. Burp them frequently so that they don't aspirate. And then feed them slowly and take rest. That's all they need. Last 3 questions. You ready? Last 3 questions. These are newborn questions. And nurse is performing a newborn assessment and document the following finding. Which finding should the nurse report to the healthcare provider? That means which one is abnormal. There may be some normal, but they have name. That doesn't mean you can pick it. Single palmar crease. Should you report it? Single vein in umbilical cord. Should you report it? Heart rate of 140. Should you? Sacral dimple. Should you? Decreased muscle tone. Should you? Cyanosis of the hand and feet. Should you? That's the key. Newborn nursing. Challenging you. Single palmar crease is a problem. We got to do a further workup. A single vein in umbilical cord is not the problem. Heart rate of 140 is not the problem. Sacral dimpling A is a problem. If you have decreased muscle tone, is a problem. Acrocyanosis is not the problem. So ADE is a problem. A newborn has a heart rate of 85 beats per minute during sleep. Is sleeping, his heart rate is 85. What would you do? document the finding as normal, notify the pediatrician, stimulate the newborn to increase the heart rate, assess the heart rate again when the newborn is awake. What do you want to do? The kid is asleep and his heart rate is 85. All this is just trying to make you pick something. Just document is normal. He's sleeping. If you wake him up, he's crying, his heart rate goes up. It's a false elevation. It's not going to help you. And let's assess a newborn moral reflex. Moral reflex, startle movement, right? Which finding is concerning? The newborn cries loudly during the reflex. Expected finding. The newborn exhibits asymmetrical movement of the hand. Not all the hand move. Should that concern you? And the newborn arm extend and then return towards the midline. It go back and forth. What's expected? The reflex is absent after the newborn fall asleep. Well, if it's asleep, why would I see it? Last question. Thank you for watching. 85 questions, English practice questions and answers, English review questions, English questions and answers. 85 questions for nursing students, English ATI NC. I know you master it. Which answer choice you pick, B is the right answer. If this video helped you and you reach 85, just let me know. Put down a comment. Let me know. Take care of yourself and good luck.